Welcome to another edition of the world famous OMS360's Between Two Molars. As you know, it comes out every Friday at 4 o'clock because we don't want to send it during office hours. I'm here with my superstar co-host, Dr. Josh Everts. Appreciate it. Thank you, Trevor. We've got two special guests today. It's unique for us. We usually do one at a time. We'll see if we can handle it. I've got Dr. Jason Lilly sitting next to me. Thank you, Jason, for being on today.
Thank you for having me. Appreciate it. This is my patient here as well, Miss Tiffany Miller, and she's joining us from Murray, Kentucky.
Hi, glad to be here.
Yeah, thank you for being here. We're glad you're here. I'll start with the first question.
Go for it.
Dr. Lilly, why don't you just describe Tiffany's case and violate all kinds of HIPAA rules?
Will do. So actually, me and Tiffany go way back. We've known each other since we were young. Her mom and my dad were friends growing up, and so we, have a long history of being friends. Tiffany started coming to me in our Clarksville office, 2 years ago, maybe 2 years ago, something like that, and had some teeth that she'd had root canaled, and were kind of, falling apart on her, unfortunately, and so we started kind of, taking the tooth out here, placing an implant, doing these things, and unfortunately, it kind of got to the point where we had placed, probably 5 or 6 implants, and I said, we brought in the Sprint Ray and we had this digital dentistry plan, and I was back to doing all on 4s again. And so I had a discussion with her. We offer this, we call it Smiles for Christmas, and I thought there was not a better candidate than, a friend to do something for her, to do a full mouth reconstruction, because we were kind of getting to that point. And so I sat down with her, and her lovely mother is here as well. And we had a discussion about if that was something she wanted to move forward with, and she did, and with great success. So we did the all on the X the same day, so everything went very well. And we did that December 5th, 4th, and so we're getting close to getting to her finals are coming in, and so she's still in temporaries right now, but
It looks great already.
yeah,
Yeah, it really does. Tell us just a little bit about how your team ensured that she was comfortable and fully informed throughout the process.
Yeah, I'll actually kind of leave that to Tiffany too. How, I come in and do my spill, but then we left you with Missy, and I think you with Megan, one of our office managers. And, how did that go?
They were very informative, and any questions I had, they answered, and they kind of led me in the right direction of how it was going to go and what I needed to do. And so it was great working with them.
And we made sure, we do a very thorough pre-op with our All-on X, where we have a lot of things written down for them, pre-op instructions, obviously, what to expect. We do very thorough consults with these patients because it is a big procedure. It's for us with the new Sprint Ray, we usually have everything done within about 4 or 5 hours. And so, we go into that process with her, that it's an all-day affair, and really kind of so she's prepared coming in, what to expect and all those things.
Great, thanks. So Tiffany, I want you to make this answer messy. So what were the challenges and how bad was it prior to coming in for the surgery? Like why did you want to have something different?
It was bad.
How bad?
The remaining teeth that I had were the front teeth, and they were just thin and cracking and chipping, and I was in pain every day. I was on antibiotics constantly for infection, and so just to have all that gone, has just been the biggest blessing, and to be able to look in the mirror and smile. I haven't had that in, a couple of years, so it's just been so great.
Yeah, maybe go a little further. What was your reaction the first time you looked at yourself after the surgery?
I couldn't believe it, because you go in with, the few teeth that you have left, and then you come out with a full smile. So you just look in the mirror and you just are like, oh my gosh, he did this in one day. And they're all, the color that you want. They look great, and you're able to walk out of the office.
To talk about too on Christmas about what your daughter told you as well too.
she had told me that we were at a volleyball game, and had looked across the audience, and I was there, and she said, "Mom, can you please just smile? You look like you're mad all the time." And so it really hit my heart because I wasn't mad. I was just so embarrassed of my teeth. I was constantly worried that somebody, wasn't looking me in the eyes. They were staring at the tooth I was missing, or, the color of them, or if they were broken. So as far as confidence, my confidence was low. And now I get to go and smile and cheer her on. So that's been, awesome.
Yeah, has she noticed a difference?
Oh, yes.
That's awesome. So Dr. Lilly, to you. This morning we heard from Dr. Burcham when he talked about job satisfiers or job motivators. So Dr. Lilly, for you and your team, how does this affect their satisfaction or their motivation in their jobs?
Well, when she came in for her first post-op appointment, I mean, the whole office was kind of buzzing. I hadn't seen her yet for the post-op, and everybody else was coming to me. "Oh my gosh, she looks great. She looks amazing. She's so excited. She's smiling." So for me, that makes me happy. But just to see the staff, see the, see what we can do in our office and the changes we can make to people's lives was a big deal. And I think for the staff, it makes them feel a little empowered that, they participated in that, because it isn't an easy surgery. That's a long day for everybody, for the staff, front desk, back staff, clinical staff, everybody. And so,
And you're hard to work with no matter what.
yeah, I mean, I'm extremely difficult. So, I'm throwing instruments all the time. So I think we had our gangster rap music on while we did it. So, yeah, so it got us all in the mood.
So we'll do one more question each. Bring the gangbuster.
So Tiffany, if you were talking to a patient who was considering this surgery, what would you tell them?
To do it. Don't wait, because just all the prior appointments that I had with other dentists, I walked into Jason's office, or Dr. Lilly's office, I'm sorry, and it was amazing. They were welcoming and kind, and they were really focused on my treatment plan, and were caring. So, and like he said, wanted to see me. I walked in the office when my checkup appointment, and they were like, "Let me see your teeth, let me see your teeth." So it makes you feel good because, you know you can smile now, and you're not having to hold back and, hide your mouth or anything.
So maybe this is unfair. I said one question each, but I'm gonna ask one question to both of you, but it's the same question. I'm trying to decide who's more excited about this, so can you guys debate that and then we can find out?
I am. I mean, this has been life-changing, so it's one of the biggest decisions I've ever made, and the best decision I've ever made. So it's changed my life. I look in the mirror and my confidence is, wow, I can go out in public now, and I can, speak to people and interact with people. And it's been a long time since I've got to do that.
For me, it's exciting because they are friends and family, and we go way back. And to be able to go, when I go back home to Murray and stuff, and see them at functions and things, for me, it's nice to see her smiling again and being happy and interacting with her family and being herself again. And so for me, that's very satisfying as well. If I'm being a little selfish, I guess.
That's great. Well, I'm very excited. I'm gonna turn to Dr. Everts to close it out. Another incredible show. Thank you so much. The cool part about this is I don't have to find the off button on my iPad. Someone's gonna hit the button out here, so over to you.
Yeah, I mean, it's just a general reminder that there are people associated with these numbers that we're talking about, right? There's an experience on the other side of our treatment. And we so often treat patients as one-time procedures when there's lasting impact to what we do. So just a great reminder in how important it is that we're delivering what's important to our patients. So thank you guys. It was great. Thanks for having us.
Thank you.
Thank you, Tiffany Miller.
Thank you. Thank you, Dr. Miller. You were amazing.